A couple of days back, a young girl around 27 came to my clinic. She was married for 2 years. She had made multiple appointments, like almost 3 or 4 times, but each time she would cancel the appointment. She would not come and meet me actually. So finally, when she made it, she came into the consultation room, she sat down, she came alone, she did not come with her partner. She's been living in the UK for the past 2 years after her marriage. Really little confused and wondering, she was not very confident about what she wanted to ask me, and I wanted to make her comfortable. I just told her, yes, dear, please tell me, how can I help you? And she was like, I'm married for 2 years, but we haven't had sex as yet. She just broke down after that. I felt very sorry for her because what she was having probably was vaginismus, which is an involuntary contraction of the muscles of the vagina, and that is a very common cause of unconsummated marriages. It is a kind of sexual dysfunction. I reassured her. I told her, don't worry, let me just see what the problem is. If you don't mind, I will do a pelvic exam or a gynec examination for you so that I can understand better what the problem is and we can find a solution to it. If you feel that your vaginal muscles are getting very tight as you're starting the process of intercourse, or as you're just getting more intimate, if you think that penetrative sex is impossible, this is a common condition. It is called vaginismus, and there are solutions to it. Just telling her this changed her whole demeanor. She became more confident, she started smiling, and she was like, so am I not alone? I felt that, she's been feeling so guilty and feeling so incompetent and feeling so lost over the past 2 years because she had a love marriage, but consummation of the marriage and intercourse was like impossible for them as a couple. So the condition that I am talking about is vaginismus. Vaginismus means that the muscles of the vagina, they just suddenly become very tight without voluntary control, because the pelvis or the part of the body which contains the uterus, vagina, the cervix, so that pelvis is having muscles which form the lower part of the pelvis, and these muscles, when they become very tight, it just kind of closes the vagina, and these couples then are not able to have sex. Penetrative sex is impossible. The causes of vaginismus could be just primary, where it's just the thought of having intercourse, or just some kind of previous traumatic experience or some kind of previous bad experience can just make the woman very anxious, very scared, and fear and anxiety itself can cause vaginismus. Sometimes, however, there could be some secondary reasons, like some severe infection or pain, or previously if they've had a fall or some kind of injury or some kind of infection. So that again makes the vaginal area they get this burning sensation, and they are kind of fearful of having intimate intercourse again. So vaginismus is a common problem. Vaginismus can be treated. What we do basically is we try to understand the problem. So it is not a quick fix solution that one day you come, you tell the problem and it gets sorted out immediately. It needs a detailed analysis. Sometimes the gynecologist, sometimes you need to meet a psychologist also, and we try to understand where the problem is. We try to teach you relaxation techniques, mindfulness techniques, sometimes use of certain jellies or some kind of medications can also help, which help you relax. Often pelvic muscle retraining is also done, whereby when the muscles are very tight, we teach you pelvic floor exercises so that you are able to understand how your body is working, what is happening to the vagina, what is happening to the pelvic floor, and those muscles which are very tight can be retrained to become more comfortable again, and you can start with the intercourse. So do meet your doctor if you are suffering from a problem like a vaginismus, or you have not consummated your marriage and that's really leading to a lot of problems. So what we do is that in case there is a problem of vaginismus, you have been suffering from this, the treatment is a multimodal approach. We, as a gynecologist, we try to understand what the problem is. We also take help from psychologists. We try to teach you relaxation techniques, mindfulness techniques, and also we try to understand, where is the problem? Is it just the fear? Is it your anxiety? And we also train the pelvic floor muscles. We teach you pelvic floor exercises. We can use dilators, and there are many methods by which we can, treatment to vaginismus is possible. In very rare conditions, or some conditions where the vagina is so tight that no examination is possible and there is so much of fear, we can even give some sedation, and sometimes a very minor surgery can also be done where we can kind of understand what is going wrong and give you the correct kind of treatment. So if you are suffering from vaginismus, if there is this problem of unconsummated marriage because of painful sex or absolutely painful penetrative sex is not happening, do contact your doctor and try to find out what the problem is rather than suffering in silence. Take